Hello, I'm Dr. Puckett. I'm with the Specialty Clinics of Georgia in Gainesville, Georgia. Focus on hand and upper extremity. We're here today in the office seeing a young lady who had an injury while walking her dog. The dog chased a squirrel, pulled the leash, and she apparently fell on an outstretched hand. She has ulnar-sided wrist pain. It's been going on for several months. She continues to have pain. It's not getting better. So she comes in today and we're going to take a look at her. Hello.
Hi, how are you?
I am good. You are Ms. Jolly Holiday.
Yes, I am.
Very good to meet you.
It's nice to meet you too.
This is the first time I think I've had the pleasure of meeting you. So you have wrist pain?
Yes, I do.
Okay. Tell me what happened.
Well, it was a beautiful spring morning and I was out walking my dog and a squirrel came out and went running across the yard and I tripped with my dog. It pulled me down and onto my hand. I fell.
And you landed in
like that.
You think in that position?
Mm-hmm.
Okay.
And hurt in through here.
Okay. And it's been hurting for a couple of months now?
Mm-hmm.
Not
Since
getting
spring.
better?
Mm-hmm. Not getting better.
So, let me see here. So you had an ulnar-sided wrist injury. It's important to do a full diagnostic exam, differential exam on you. Let us start with the DRUJ. This is called a Pienicky test. Assess it in neutral, which has a lot of play, especially in a person who has increased laxity like you. I like to supinate it, which will tighten up the ligaments in the DRUJ and assess it there. And then I also like to pronate it. And so I feel yours, you don't have an injury there. I really feel them tighten up in pronation, supination versus neutral. I'm assessing the strong radial-ulnar ligaments of the DRUJ when I'm assessing that, in addition to the secondary stabilizers, the interosseous membrane, the pronator quadratus muscle. They're all stabilizers of the DRUJ, in addition to the what some people call the ulnar collateral ligaments of the wrist. When I am assessing it, I'm basically assessing the stability of those ligaments. As you see, when you supinate the wrist, you're going to tighten the dorsal ligaments. When you pronate the wrist, you're going to tighten your palmar ligaments. The TFCC itself. In some injuries with the TFCC, your DRUJ is still very stable, so your ligaments are intact, your secondary stabilizers are intact, but the TFCC itself can be injured. And this is called a foveal test. This is called a grind test, which will pop and click a lot of times if you have a tear. And you can do a press test, which is also very specific for an injury to the TFCC proper itself, with still having good ligamentous stability to the radial-ulnar ligaments. In addition, it's important to consider the volar side of the wrist. The volar side of your wrist, you have your pisiform, which has an articulation here. That can cause pain with arthritis, osteochondral contusions. Insertional tendonitis can also be along the course of the pisiform where the FCU or flexor carpi ulnaris comes in. And you would feel that right at the distal wrist crease. That is right where you feel the pisiform and the insertion flexor wrist of your FCU. In addition, it's important, and you can see it nicely on your wrist, to see the extensor carpi ulnaris tendon, the ECU tendon. It's in the 6th dorsal compartment, which is created by your extensor retinaculum. You can have interstitial tears or pain along the course of the tendon. You can feel that with just direct palpation. You can have insertional tendonitis, or a common place for calcific tendonitis or any other inflammatory condition, where the extensor carpi ulnaris inserts into the base of the small finger mid-carpal. In addition, you can have injuries, especially with a fall and an outstretched hand, to the subsheath, which is basically the tunnel, the floor of the tunnel that's created by the extensor retinaculum with the ECU. And if that tears, your ECU will subluxate over the ulnar head. And the way I check that is with a fuss maneuver. Flexion, ulnar deviation, supination, and then resistance towards my face. You push your hand towards my face, not your arm, and that would create a subluxation if you had an ECU subsheath injury. In addition, on this side of the wrist, the triquetrohamate joint can have pain. It's hard to really appreciate on this model, but that would be right in this area, the triquetrum and the hamate, right in that area. You can get synovitis in that joint if you have a symptomatic mid-carpal instability or a supinate axial pressure. Relax your arm and test for mid-carpal instability. You could also have pain along the triquetrohamate joint. The base of the hamate, right in that area right there, you could also have pain, which would be in this area right here. Of course, nerve pain could cause problems. And this area right here is where your dorsal ulnar cutaneous branch of your ulnar nerve gives sensation. You can see the yellow dorsal ulnar cutaneous branch coming through here. That can create pain and burning in this area, in addition to a cubital tunnel, which would also create numbness and abnormal sensation in this area, in addition to the ulnar digits, which you could assess with a compression test. Guillen's canal you can assess, which could also give neurologic type pain, or even vascular claudication or pain could be associated with Guillen's canal on this side of the wrist, which might recreate some pain with palpation and flexion. It would recreate symptoms along the ulnar digits, yet the dorsal ulnar cutaneous branch would have normal sensation because it branches off prior to compression in this area, as you would see. The extensor digitorum to the small finger comes through the fifth compartment. You can see it on the back side of the ulna. You see it nicely on this patient. Extend your finger. That could create pain from stenosing tenosynovitis in this area right here through the fifth dorsal compartment.